Hey guys, welcome back to astoldbypala. So good to see you guys. I know I haven't been very good with vlogging last year because last year was quite intense, very busy year. So I had to, unfortunately, well, not for, unfortunately for you guys, I was a bit negligent when it came to vlogging. But fortunately for me, it was worthwhile. I finished the year pretty well, and I was really happy, like with my final achievements for the year. I think I finished the strongest points that I've ever finished. That said, I did experience last year a little bit of burnout because I focused too much, I think, on my academics. And I will do a separate vlog about burnout. I think probably even next week. But for now, on a lighter note, I want to talk about the transition, the beautiful butterfly, out of the cocoon transition into a third year medical student. So, what does that mean? That means no more just lectures. Now I'm in the hospital 24/7. Well, not 24/7. We're not yet there. That's residency. Residency is when you're going to be like, yeah, 24/7 in the hospital. But for now, it's like 8. What time do we start? We start 8. 8 to 4 o'clock, we're in the hospital and we do different rotations. So far we've had geriatrics, we've had pneumology or pulmonology, and we are in gastro at the moment, and I think we have cardio next. So it's quite exciting. One of the things that I really like about clinical sciences or being in the clinical sciences component of med school is that finally for 2 years, you put in work and the med school has med school is interesting when you're learning about the topic, but when it comes at you so much and you have so many exams, it starts to feel like you're jumping through hoops, just to make it out. And you start to lose sight of the beauty of it all. And so when you finally get to third year, it's like, hallelujah, hallelujah, hallelujah. It's a big picture. You've got all your disciplines and they're now all connecting to make one bigger picture. And, it's really nice because then you really start to appreciate everything that you've learned and you start to apply it. So my vlog topic today is just kind of talking about the differences between preclinicals versus clinical medical education and things that I would recommend to somebody who's preclinical going into clinical classes that I wish somebody had told me prior to starting med school. Okay, so first things first. Um, if there's any subject that you think is not going to matter when you get clinical classes, forget it. For example, I'm not interested in dermatology. So when I learned dermatology, I kind of learned it when I learned it in my basic sciences. I kind of learned it for the sake of learning and passing my exam and like trying to know the more common lesions that I thought I would come across. Like for instance, I'm interested in pediatrics, and so one of the things that I was like, oh, I'll know like the kids diseases, things like cellulitis and pedigree. That's the stuff I'll focus on, but I won't spend too much time on dermatology. Well, boy, can I tell you something that everything you learn matters. I'm now finding myself going back to dermatology, trying to learn what I thought would not be important because it's all important and it's all added up in the grand scheme of everything. So that's one thing that I just want to say. If you're in your basic sciences classes, don't ever think that you're going to go into cardio and so dermatology doesn't matter. It will matter unless you're going to be like a surgeon. But even if you're a surgeon, I mean, if you're cutting up a patient and you're uh, I don't know, cardiothoracic surgeon and you see a lesion on them and it could be cancerous, you know, that's something that you should be able to pick up on. Even if it's not your discipline, it's something that you should be able to recognize. Um, so, yeah, it's just in that sense that I want to say that when you're in your preclinical classes, in your basic science classes, it's important to really pay attention to everything that you learn. The other thing that I would just say is if there's a way to learn where you're not learning to pass the test, learn it I mean, we all know we're learning in med school to be great doctors, but sometimes it's different because you think you've learned something really well, and then you get in front of a patient and the doctor drills you on what possible medications you can treat, malaria, for example, and you list like three, but there's like five of them, and you can't remember the other two. You realize you don't really know it well enough. So if there's a way to review your knowledge and you have time to do it, please try to make an effort to do that, because it is literally rinse and repeat, rinse and repeat. That is what medical school is um, about. I won't say all of it, but I'll say a good percentage of it is rinse and repeat, and then obviously experience. Um, Try and learn. If you're like our school basically we were module, not module based. Most schools are like system based, so you go through cardiovascular and all your different subjects, and it ties up really well. But if your school is not module based, try and tie up your knowledge. So like, let's say if you're in pharmacology and you're learning about, gastrointestinal medication, try and go back to your pathophysiology, pathology notes, and go back to that knowledge so that you refresh and you understand, because the more you associate things together, the better you are going to be at grasping, the ideas collectively. So when a patient presents to you, you can quickly already start to think off, the top of your head, like, okay, these are the possible medications he's on, these are the possible complications, or what medications could have caused this. So it's not just a one-dimensional picture, it's a 3D picture of everything kind of coming together. So that's one thing I would say, is really treat every subject with importance. That said, some subjects, in my opinion, are very, very, very crucial and really cannot do without them. And no matter whether you love them or hate them. One, pathophysiology, the disease process, because apart from the fact that that's how pharmacological manipulations are, applied, it also ties in with your symptoms and the clinical presentations that you will have to diagnose within the hospital as a doctor. So it's kind of like the basis of these two arms that are very important. Um, the symptomatic presentations, which will be your diagnosing part, and also your pharmacological component, which will be how to treat your patient. So you need to be able, if you know the disease process, you can start to already think, what labs should I run? What would I expect to see? Three things that I would really say, please, please, please spend time on is pathophysiology, pharmacology, and then what did I forget now? No, pathophysiology, pharmacology, really those two. Um, and pathomorphology, if you have the two split. That's why I was getting confused, because some schools teach pathophysiology and pathomorphology together as one subject, which is just pathology. Our schools taught it as two separate subjects, so that's why I'm saying pathophysiology, pathomorphology, and pharmacology. Another subject that I would say is really, really important to definitely know is microbiology, especially in terms of recognizing diseases and treating them with antimicrobials. So, the other thing that I wanted to mention about preclinical versus post-clinical is that it's quite different. The learning is quite different. I feel like when I was in preclinical, I learned a lot of, I'm learning for exams, so I'm learning about, I don't know, stress ulcer, I am learning about, I don't know, Cushing syndrome. Like, I'm learning about, a separate disease, A, B, C, D, E, F, G. But when you get to clinical applications, you have a patient that presents with maybe abdominal pain. What are all the possible things that can cause abdominal pain? So it's kind of working your way back to front, whereas before you were learning it from disease to symptoms. Now it's like, I have these symptoms. What are the possible things that could all be causing these symptoms? And so it's kind of having to switch your mentality. And I feel like, whereas before in preclinicals I could read these things, now it's a lot more of, becoming knowledgeable through experience, because the more experienced you are, the less likely you are to skip things or to forget them. If you see, for example, like a patient that comes in and you forget to ask them something like, do they have diabetes? And you remember it, like next time, like don't forget that. You're going to be sure on the next patient to include it in part of your whole overview of your patient and taking down notes. So that's one thing that I want to say, is that it's a lot more of a holistic picture and not separate entities like in preclinical sciences. So clinical sciences is really tying it all together. Again, I'm going to keep stressing that it's like a meshwork, because it really is like a meshwork. The other thing that you will realize in clinical is you will realize there's some subjects you really like and there's some subjects you really don't like. For example, I'm interested in pediatrics or internal medicine. I haven't made up my mind yet. I will make up my mind by the end of this year, which is going to be exciting. And I can't wait to share that journey with you guys, journey to hopefully residency. But yeah, one of the things you will realize when you're in clinicals is you have perceptions of what specialty you want to go into. And then when you're actually in the ward, you're like, I'm not too sure about this, or I'm not as interested in this. For example, for me, as me wanting to go into internal medicine, I I was stronger in gastrointestinal diseases. I would say coming out of basic sciences, I knew a lot more about the pathophysiology of gastrointestinal diseases. Coming to clinical applications, I found the gastrointestinal component of the clinic of our clinical rotations to be not boring, but I think not as exciting as I thought it would be. And then, ironically, I used to find um, the respiratory system quite difficult to understand when I was in basic sciences, but coming into clinical sciences, I actually find it very interesting. So it's very funny because these things kind of get meshed around, and you start to kind of question yourself, and you start to see, like, you go in with one perception going into med school, like I'm going to do this, and then you get there and you're with the patients and you're like, oh, maybe I wouldn't do this. Case in point, I thought cardiology would be so awesome. It's cool, I like it, it's interesting, but I don't know if I could see myself doing cardiology. And then there's something like geriatrics, which I was like, no, I'm not going into geriatrics. Now I love the old patients. I love meeting with the old patients. They're so cute, they're so sweet, and apart from that, they are just really like, they're very like, I don't know how to say, they are patients that you really want to help, because you can see like they're dealing with so much. And so I have a lot of compassion for the elderly patients, and I thought, for me, I thought working with elderly patients would be hard to do because they're a lot more fragile. But that's not the case. I actually find like it was actually quite interesting to do in geriatrics. So again, this also helped tie in into my decision that you know, I kind of want to work with older populations too, and I still want to work with kids. So then there's that whole thing of, okay, well, maybe internal medicine looks good. So now internal medicine's coming a little bit more to the forefront, whereas before I wanted to do pediatrics. So yeah, I just wanted to say, have an open mind when you come into clinical sciences, and just enjoy learning, because you're going to learn so much, and enjoy the experiences and let yourself naturally gravitate to what you should be doing. So those are the main things that I would say really stood out to me, going from preclinicals to clinical sciences. But other than that, I'm really loving, being in clinical sciences. I enjoy it a lot more, and it's funny because I feel more. I wouldn't say on the same level as doctors, not at all, but I feel definitely a lot more competent. Initially, I was like, oh, I don't know this, I don't know that when the teachers ask, but it comes with time. So if you're starting off your third year and you're kind of feeling iffy, it gets better. And then you get residency, and then it's a crappy experience again, and you're like, I don't know what I'm doing. But for now, enjoy it, because you'll get to be a doctor without all the real responsibilities, because somebody else has to kind of answer for the patients that you have. Um, so yeah, all I can say is Third year is really good, and I will not waffle too much because this is really just me updating you guys on how third year is going. Let me know what subjects maybe you guys are struggling with that you would like advice on how to study for. I will be honest and tell you I either did really good in that subject or I did really bad in that subject. And yeah, if that's the case, I will tell you honestly, like I'm giving you my advice and I did well in the subject, or I'm giving you my advice and I just got there. It was a subject I struggled with, but I ended up doing decently enough. So yeah, I'll try to be as honest as I can. But thanks for tuning in today, guys. I really like being back here. I've missed this, and yeah. Anyways, this I don't want to talk about burnout. That's coming in the next blog post. So be sure to check it out. And if you're not subscribed, subscribe so you can see this next video. Bye, guys. See you later.